Bismillahirrahmanirrahim. Quote of the day is who say, when struck by a disaster, surely to Allah we belong and to Him we will all return. This is the quote from Quran. My name is Dr. Aamna Khalid. I'm PGR Community Medicine and today I will present the topic of disaster management under the guidance supervision of Professor Dr. Saila Afsar Investigating Institute of Agriculture, Lahore. Learning objectives for today's presentation are we will define disaster and classify its major types, differentiate types of disasters, explain the disaster management cycle, public health impacts of disasters, describe key response strategies, the outline of prevention, mitigation, and preparedness measures, and then the practice of MCQs. A disaster is a serious disruption of the functioning of a community or society, causing widespread human, material, economic, or environmental losses, exceeding the ability of the affected community to cope using its own resources. Most disasters are sudden and unpredictable, but some, like drought, are slow onset. Types and classification of disasters. They can be classified based on the source into the natural or environmental disasters and the human or induced disasters. The natural disasters include meteorological disasters, which include storms, hurricanes, cyclones, heat waves, drought, smoke. Then the topological, which includes floods, avalanches, and landslides. The telluric and tectonic disasters, including earthquakes and volcanic eruptions. Then we have human-induced disasters, which includes accidental. Examples include dam failures, mine explosions, fires, collisions, shipwrecks. Then the water contamination events, atomic explosions and nuclear disasters, radiation exposure incidents. Then we have a CDC classification of disasters, which include the natural disasters, again almost the same thing which we discussed in the natural or the environmental disasters. And then the second category is technological and complex, which include nuclear accidents, chemical spills, bioterrorism or oil spills, industrial hazards, complex emergencies, including conflict or war, population displacement, breakdown of systems, high mortality. Then the main effects of disasters are loss of human and animal life, damage to property and infrastructure, disruption of essential services like electricity, water supply, sewage systems, communication networks, food supply chains, healthcare services, and spread of communicable diseases. The morbidity patterns in disasters include injuries like trauma, burns, crush injuries, psychological stress like PTSD, anxiety, depression, epidemics due to overcrowding and poor sanitation, displacement-related diseases, and contributing factors to all of these are contaminated water sources, breakdown of disease control programs, and vector breeding due to ecological changes. Now we come to the disaster risk and management cycle. One concept is the disaster risk concept, means we can calculate the risk of disaster by using hazard, exposure, and vulnerability or the capacity. Then we have disaster management cycle. This is a continuous cycle um, in which if a disaster occurs, then we first of all give a response, then we move to the recovery, and then we before a disaster we have the mitigation and preparedness activities. First stage is preparedness. The preparedness can include early warning systems, um, the disaster planning and policy development, training and simulations or drills, resource mobilization and pre-positioning, public awareness and education campaigns, community preparedness and programs. Then the second phase is response. This is the immediate action following the disaster onset. The search and rescue operations are part of response. The first aid and emergency medical care, triage of casualties, emergency relief distribution, activation of incident command systems, All of these are part of response phase. Then the third phase is recovery phase, which include rehabilitation of the affected populations, reconstruction of the damaged infrastructure, restoration of the essential services, long-term physical and mental health support, economic recovery programs. Then the fourth phase is mitigation phase, which includes the risk reduction strategies and policy, safe building construction codes, land use planning and zoning regulations, environmental protection measures, structural flood control measures, and climate change adaptation strategies. So now we come to the detail of the activities in disaster management. The first phase of activities is the pre-disaster activities, which include disaster risk reduction, DRR. The risk assessment includes the hazard identification, vulnerability analysis, capacity assessment, and risk ranking or prioritization. The tools used for this risk assessment are the hazard maps, the historical data, and the seasonal calendars. The disaster mitigation strategies include safe building construction and retrofitting, land use planning and zoning, agriculture diversification, flood control, including embankment and drainage systems, environmental protection and restoration. So these activities are more um, focused on maintaining the infrastructure in such a way that we can face a disaster without loss or minimum loss. Then we have the disaster preparedness activities, which includes warning systems and the emergency drills and simulation exercises, public education campaigns, community participation and capacity building, and development of emergency response plans. Then some activities are done during disasters. The first one is response phase actions. This includes we have to activate the incident command system. Search and rescue operations are done. A first aid and triage is provided at the site. Field medical care and stabilization. Rapid needs assessment. Coordination with local and international agencies. So this is the triad system. The first color code is red, which means that immediate attention is required and life-threatening injuries are requiring immediate care. Then the second color is yellow, means we can delay the management. He is serious but stable, and we can wait for the treatment. Then the third color code is green, which means it is minor, means minor injuries are there, and the person is walking with the wounds. He is mobile. And then the fourth stage is black, means it is expectant or dead, and unsurvivable injuries are the person is deceased. The goal of maintaining this triad system is the maximum survival with limited resources. Then we have the incident command system. As we said, we have to activate the system. What is it? This is the standardized emergency management system, which it ensures the key authority, coordination, and accountability. The key roles are there is an incident commander who is the who has the overall control. Then the safety officer is monitoring the hazard. Then the liaison officer who is coordinating with the agencies. Then the public information officer, who is the media or public person. And the rapid needs assessment. The purpose for rapid needs assessment is to identify urgent needs, guide resource allocation. And the steps are, first of all, we collect the data from affected areas. Then we analyze and verify the findings, and then we prioritize our response actions. The key indicators used for this assessment are the mortality and injury rates, water access, food availability, shelter needs, and disease patterns. Then we have the post-disaster activities, which is the recovery phase. The relief phase includes the activities like food, clothing, and shelter provision, surveillance for disease outbreaks, and the public health measures include the disease control and outbreak response, vaccination of the diseases like cholera, typhoid, and tetanus, safe water supply and sanitation restoration. Then the rehabilitation phase. includes restoring the infrastructure like health system restoration and strengthening nutritional support programs, vector controls like mosquito and rodent programs, mental health services and psychosocial support, and community-based rehabilitation is done. Now we come to the flood management in Pakistan. Flood risk in Pakistan. Pakistan faces frequent floods due to the monsoon rains uh, ranging from June to September, then the glacial melting, poor drainage infrastructure. The root causes are the weak policy implementation, inadequate drainage systems, and sedimentation in dams and rivers. The flood control measures include the structural measures and the non-structural measures. The structural measures are embankments and levees, dams and reservoirs, spurs and river training, channelization of the rivers. Then the non-structural measures are we have to focus on the flood forecasting systems, early warning systems, land use planning, floodplain zoning, and community preparedness. These are some of the institutional framework working for the flood management. First one is NDMA, which is National Disaster Management Authority. Overall disaster management coordination is done by them. Then the second one is FFC, the Federal Flood Commission. The flood control planning and oversight is seen by them. Then WAPDA, Water and Power Development Authority. The dam and reservoir management is under their control. IRSA, Indus River System Authority, the river water apportionment is their duty. Then we have integrated flood management, which again almost this is the repetition we have already done it while studying the management cycle. That flood plain zoning and management, reservoir and dam operations management, early warning and communication systems, community-based preparedness planning, post-flood rapid needs assessment, and linkage with the climate change adaptation. All of this is part of integrated flood management. So public advice during floods. Before a flood, they should be advised that they have to avoid the flood-prone areas, monitor weather forecasts, prepare emergency kits. During a flood, they are advised to switch off the electricity, move to higher grounds, and avoid contaminated water, and especially safeguard their children and their elderly people. After a flood, they are advised that disinfect their premises first, use safe drinking water only, and avoid unsafe or flood damaged food. And they should move back to their areas only after the authorities have announced. And they should discard all the food in their houses, either it's good or bad, apparently. Health priorities, surveillance for disease, vaccination campaigns, and mental health support. These are the health priorities for the, flood management. Then we have the drought management in Pakistan. The drought situation in Pakistan is that it is increasing water scarcity year by year. Per capita water availability is declining drastically, and Pakistan transitioning towards the water scarce country status. Drought affects agriculture, livelihoods, and public health. The drought mitigation strategies include the water interventions and the agricultural strategies. The water interventions are we can rain water harvesting systems can be developed, water storage and conservation, water recycling and reuse, tube wells for groundwater access. Then we have agricultural strategies that drought resistant crop varieties, efficient irrigation techniques, crop diversification, and soil conservation practices. These are some additional drought strategies, including climate change adaptation programs, community-based disaster risk reduction, watershed management and protection, afforestation and reforestation programs, and national water policy implementation. Then we have a Sendai framework for disaster risk reduction. This is a global framework which has four priority areas. The first one is understand the disaster risk, strengthen the disaster risk governance, invest in the disaster risk reduction for resilience, and enhance the disaster preparedness for effective response. The target is to reduce disaster mortality, economic losses, and damage by 2030. Then we have the things where standards. These are the minimum humanitarian standards in disaster response, and this covers five domains: water, sanitation and hygiene, the wash, nutrition and food security, shelter and non-food items, health action, and the standard is that 15 to 20 liters of water per person per day minimum is the requirement or uh, standard. The emerging concepts in disaster management include the climate change and increasing disaster frequency, urban disaster management, pandemic preparedness and health system resilience, digital early warning systems and AI, One Health approach, and community-based adaptation strategies. Okay, this is the vulnerability and risk factors that high risk groups which we need to focus on are the children under 5, elderly over 65, pregnant and lactating women, persons with disabilities, poor and marginalized populations, and the types of the vulnerability include physical, social, economic, and environmental. If we apply the levels of prevention to the disaster management, although we have almost covered it already, but from the point of view of the levels of prevention, the primary level is to prevent a disaster or reduce the risk. These includes the mitigation, preparedness, and risk reduction activities. Then the secondary prevention is the early detection and rapid response, which includes the triage, first aid, and early response activities. Then the tertiary prevention level is minimize the long-term impact, so we focus on the rehabilitation, mental health, and reconstruction. So if we say that what are the public health priorities during the first 72 hours, then the first thing is rescue and search and rescue. This is a life saving priority. Then the water supply, minimum 15 to 20 liter per person per day is the requirement. Sanitation, one latrine per 20 persons. Shelter, 3.5 meter square per person is the minimum land required. Their food 2,100 kilocalories per person per day, and surveillance disease outbreak monitoring. These activities should be started during the first 72 hours. Then we have the psychological impact of disaster, which is very important. There are some common mental health effects, including the post-traumatic stress disorder, PTSD, anxiety disorders, depression and grief, and substance misuse. And the management include the psychological first aid, community psychosocial support programs, and the long-term mental health services should be provided to the people. The logistics and supply chain in disasters, that we should focus on the transport challenges in the disaster zone, supply shortages and procurement issues, cold chain maintenance for vaccines and medicines, equitable resource distribution, warehouse management and inventory tracking, coordination with humanitarian supply chains. There are some ethical issues in the disaster management, um, like resource allocation during the scarcity, triage decisions, and triage decisions, equity and efficiency dilemma, consent in emergency treatment, privacy versus disease surveillance needs, prioritizing local versus external needs, and accountability of the humanitarian actors. So these are the some of the case studies from Pakistan. There was a major flood in 2010. Although almost every year Pakistan is afflicted with flood, but the major flood was in 2010 with massive population displacement, disease outbreaks, cholera, malaria, dengue, infrastructure collapse. Around 20 million people were affected. And the lessons learned were that there was a need for integrated response. Then we had an earthquake majorly affecting Kashmir and the surrounding areas like KPK and others in 2005. And there was high mortality, around 73,000 or more deaths were occurred. Delayed response in remote areas, winterization challenges, mental health burden, and the lesson learned was that we should have pre-positioned resources that were vital to manage this disaster. Then one thing is climate change and disasters. There is increasing frequency and intensity of disasters due to the more intense floods and storms, prolonged heat waves, and worsening droughts. And SDG 13 has the focus on climate action, and SDG 11 has the focus on sustainable cities and communities. So to reduce the risk of disasters, we need to focus on um, working on the sustainable development goals as well. All right. So conclusion is that disasters are basically inevitable, but their impact is preventable. We have to focus on the preparedness, risk reduction, and the community resilience. Multi-sectoral approach is essential for effective disaster management. Pakistan needs strong institutional frameworks and sustained investment. Climate change demands urgent integration into the DRR, the disaster risk reduction strategies. Now we come to the practice of MCQs. Question number one is, after a heavy rainfall, a rural district reports multiple cases of acute watery diarrhea within 3 days. Most patients used flood contaminated water. What is the most appropriate immediate public health priority? Option A, start rehabilitation program. B, provide safe water and sanitation. C, begin long-term mental health support. D, conduct detailed epidemiological study. And E, rebuild damaged infrastructure. Option B is the right answer. Question number two, following an earthquake, a doctor is triaging the patients. A patient with severe bleeding and airway obstruction is classified as option A green, B yellow, C red, D black, and E blue. This is red because he's having airway obstruction. He's very focused on initiating systems, planning, law, fields, and providing systems. Resources. This is the space. Option A is force. B is
D.
is the right answer. Question number four. During disaster response, a patient with minor abrasions is walking and asking for help. What is the correct triage category? Option A. Option A red. Option B yellow. Option C green. Option D black, and E white.
C.
Yes, C is the right answer. Question number five is, a country invests in flood embankments and improved building codes. This is an example of option A preparedness, B response, C recovery, D mitigation, and E rehabilitation.
A. A.
This is mitigation. One hint about it is that if we talk more about the maintaining the infrastructure in such a way that we have to face the flood, then this will be a part of mitigation. And preparedness includes more about the health services and other things, including the services basically, which is part of the preparedness. All right, now we come to the question number six. Following a disaster, a patient shows persistent fear, insomnia, and flashbacks. Most likely diagnosis is option A depression, B anxiety disorder, C PTSD, uh, D schizophrenia, and E bipolar disorder.
A. PTSD.
Yes, PTSD. This is a post trauma. Question number seven. Our district uses hazard maps and historical data to identify flood-prone zones. This is part of option A, risk assessment, B, response, C, recovery, D, rehabilitation, and E, surveillance.
Surveillance.
Option A, risk assessment. Question number eight. After a flood, stagnant water leads to increased mosquito breeding and malaria cases. This is due to option A, host susceptibility, B, agent virulence, C, ecological changes, D, genetic mutation, and E, drug resistance. This is due to the ecological changes. Question number nine is, our government ensures water storage, rainwater harvesting, and drought resistant crops. This is option A, flood control, B, disaster response, C, drought mitigation, D, rehabilitation, and E, the surveillance.
C.
Yes, C is the right answer. Drought mitigation. Question number 10. A coastal city is hit by strong winds, heavy rainfall, and storm surge, leading to flooding and infrastructure damage. This disaster is best classified as option A, topological disaster, B, meteorological disaster, C, technological, D, complex, and E, telluric disaster. B is the right answer, meteorological disaster. This is the answer key to all of the questions. This is the YouTube channel of IPH, where this presentation will be uploaded. Thank you so much.